This episode is sponsored by Therapy Notes, therapynotes.com. Be sure and check them out and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Well, hello, folks. It's Gordon, and this is the Practice of Therapy podcast, and you're listening to episode number 292 of the podcast. And if this is your first time listening to the podcast, glad you found us, glad you're listening in. And if you're coming back for more, glad you're back, and hope you've taken time to follow or subscribe to the podcast wherever you might be listening to it. So I'm looking forward to this episode for you to hear my conversation with Lauren Hawkins. And Lauren and I delve into a topic that I don't think I've tackled on here, but it's certainly a relevant topic given what we've just come through with this summer and the heat wave and just how climate is affecting people's mental health, and in particular just the anxiety around climate change. So I'm looking forward to you hearing our conversation and just some of us sharing some of our own experiences about that and really taking a more holistic approach with our clients, because I think a lot of times we might kind of overlook those environmental factors that might be affecting people. And I think it's well worth delving into. I share in this particular episode just kind of some work that I've done in the past, particularly here in the Appalachian region, just helping families that are really living in extreme poverty and also just helping them with kind of their physical needs. Was on two fronts, really. One was some volunteer work that I was doing back when I was the coordinator for Episcopal Appalachian Ministries, but also in my work as in an agency for an organization that worked with at-risk children and youth, and it was an in-home counseling, intensive in-home counseling that we did with the families and youth. And I really got to see a lot of conditions that most people might be surprised by. And so really understanding how poverty and the environment that they live in really affects people's mental health and just really our whole wellness in general. So anyway, we'll get to my conversation with Lauren here in just a minute. Before we go there, though, I'd love for those of you that are out there that are maybe just getting started in private practice, and I know there are a lot of folks like that listen to the podcast. You're really trying to figure out the best way to do it and how to move maybe from agency work into private practice. One of the resources that I have, or one of the membership communities that I have, is called the Practice Launch Club. Haven't said much about it on the podcast here lately, just with all of things that are going on in my life. But anyway, I'd love for you to go check it out. And if you'll go over to practiceoftherapy.com/practice launch club. And this community is a great little community for those that are just getting started in private practice. We meet 2 times a month via Zoom for kind of a mastermind and sharing ideas and really troubleshooting things. We'll usually have a hot seat where somebody presents an issue that they want to work on. But also there is a whole library of resources available to the members of the Practice Launch Club on the Teachable platform. And most of them are just short lessons that I've put together teaching different concepts around private practice and what it means to be a private practice owner and go into it. And also just other resources like paperwork packets and those kinds of things are available for the members. And also we have a private community on the Circle platform where we interact in between our meetings. So I'd love for you to check it out. And if you'll go to practiceoftherapy.com/launch club, and if you'll sign up between now and the end of September and use the promo code just PLC Fall 2023, you can get $20 off your monthly membership. So be sure and check it out. Practiceoftherapy.com/launch club. Hope to have you join. And also, before we get to my conversation with Lauren, I'd love for you to hear a message from one of the people that are one of the podcasts that are part of the Sightcraft Network, and also our sponsor of the podcast, Therapy Notes.
Hi, everyone. I'm Aaron Potratz.
And I'm Nathan Hawkins. If you don't know us yet, we are the voices behind the Shrink Think podcast, which is part of the Sightcraft network of podcasts.
We are so proud to be a part of this network, along with the Practice of Therapy podcast with Gordon Brewer, and the great work he is doing to help people in their journeys.
And if you haven't discovered the Shrink Think podcast, you can find us wherever you listen to your podcast. We'd love for you to join us as we seek to help you with your relationships, your healthcare practices, and your therapy journey.
Join us as we bridge the gap between clients and therapists. And be sure to check us out at shrinkthink.com/podcast and take our free e-course.
And have a great day.
One of the keys to a successful private practice is having the right systems and processes in place to make things run as smoothly as possible. With a system like Therapy Notes, you'll have more time to spend with what matters most, your clients. Therapy Notes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. Your clinical records will be secure with less paperwork, which means you can give a much better quality of care. It's the EHR that Gordon uses in his practice. Be sure to check them out today by going to practiceoftherapy.com/therapy notes, and be sure to use the promo code GORDON to get 2 months free.
Well, hello, everyone, and welcome again to the podcast. And I'm really looking forward to you hearing from Lauren Hawkins. Welcome, Lauren.
Hi, welcome. Thank you.
Yes. So Lauren and I kind of got introduced by a fellow podcaster. And when I started learning about Lauren, I think she's got some really interesting stuff for us to talk about. But Lauren, as I begin with everyone, why don't you tell folks a little bit more about yourself and how you've landed where you've landed?
Yeah, so I am a independently licensed professional counselor in both Texas and Colorado. I'm based in the Dallas, Texas area. I work mainly with individuals who have gone through some sort of trauma, do a lot of trauma work. I'm trained in EMDR, so I use that frequently. And I also work with the LGBTQ plus community.
Awesome. And I know one of the things that you've been passionate about and done some recent presentations on is just how climate change is affecting our mental health. And I think certainly that is something that is in the forefront as we're recording this. Just if you watch the news at all, this is the hottest year ever that they've recorded. Yeah. So tell us more about that and how, really kind of how you've landed in the kind of that niche.
Yeah. So back in February, I think it was, of 2022, I published a manuscript in the Journal of Counselor Leadership and Advocacy called Climate Change and Mental Health, the Counseling Professional's Role. And really, it's just sort of exploring this relationship between climate change and mental health, and more specifically looking at it through a counseling lens, and just, how can professional counselors be involved in this? Why does it, even matter? How is this showing up in the therapy space? And then recently, I also got to present on that same topic at the NBCC Bridging the Gap Symposium in Atlanta. So that was really cool. But yeah, like you said, just actually a few days ago, I think it was July 3rd through July 6th, were it was 4 consecutive days in a row that were the hottest days ever recorded, like on Earth. So this is something that is like an immediate concern that's going on.
Right. Yeah. So tell us a little more about what you learned through your research and all of that sort of thing, and how it's affecting us.
Yeah. So, well, for me, I approach kind of all of my work through a holistic counseling lens. And I think people sometimes hear that word. It's thrown around a lot, but there's no solid definition of it always. But for me, basically what that means is just looking at your client as a whole person, looking at all of these different interconnected pieces of their life, not just seeing them for the symptoms that show up in our office. And so when I was taught a lot in grad school about just the different models of holistic wellness, the wheels of wellness that are out there. I'm not sure if you're familiar with those or not, but there's just kind of various models of this holistic wellness, idea out there. And one thing that I noticed was always missing from these. We've got there's financial wellness, there's social wellness, physical, emotional, mental, all of these different pieces that make us up. And they did talk about environmental wellness in these models, but it was never specifically about our connection with nature. It was just sort of it could fit into that category, but it was never specifically talked about. And I thought that was strange, because it's this one piece of this puzzle that, just we are all affected by, we're all connected to. Nature is, when we think about our basic needs, food, housing, water, things like that, it's all a product of the environment, the natural environment we're in. Right. And if we don't have those basic needs, we don't have much else. So I thought it was interesting that was kind of never included in the conversation.
Right. Yeah. And I know for a lot of us, just if we think about just the whole issue of climate change and just how we're seeing it affect the world, I think for a lot of us, we feel kind of helpless to do anything to change it. And I know, it's kind of that whole, I'm reminded of that starfish story, of the guy going down the beach and seeing all these starfish washing up on the beach, and he's putting them back in the ocean. And somebody says, you're not going to make any difference. And he just said, I'll make a difference for that one. But in your work with clients, what sort of themes are you seeing come up around just, and I'm making assumption that climate change issue is something that brings people a lot of anxiety.
Mm-hmm. Yeah. So there's actually something specifically called eco-anxiety. And it's just this term that's out there. And it's sort of just this idea of, there's the general anxiety that we all see, right? But eco-anxiety is sort of this awareness of climate change and the impacts it's having on mental health, and the understanding that as climate change worsens, as temperatures continue to rise, as natural disasters continue to happen, whatever it is, right, that our mental health is going to also continue to worsen. And I think it's interesting too, because when we don't take this holistic intersectional approach, we might miss this big piece of what really is driving some of our clients' anxiety. And I think it's interesting because since it's not something that's talked about specifically within the counseling field as often, or just sort of in general, sometimes our clients might not even have words to put to this anxiety that they're feeling. But, with this eco-anxiety, it's definitely already showing up in our therapy spaces, whether we're acknowledging that or not. A lot of it, there's just the general anxiety that we see, but there's also symptoms like hopelessness and depression and just fear of the future, or an inability to plan for the future because of this, worry about what that's even going to look like.
Right. And so what have you found is a good kind of segue in bringing that up with clients as far as, helping them understand that about themselves, or being able to recognize that as an issue?
Yeah. So again, for me, I think that I'm just really of the belief that I think like all counseling should be holistic, that we should be taking into consideration all of these parts of our client. I think we're kind of doing a disservice if we're not. And I think it's, not fully trauma informed to not be doing that too. So for me, it's something that I sort of do already. I kind of going back to there's a Wheel of Wellness. The first one was created by Sweeney and Whitmer, I think in like the 1990s. And then there was another one created by Myers and Sweeney in the 2000s sometime. And then there's a newer model too that's been created by Dr. Ryan Reese that includes this eco wellness piece. And I think using these models in our counseling work can be a really like easy way to bring this stuff up, because it's not like you have to even sit there and say, okay, today we're going to talk about climate change and how that's impacting us. It's just like, here's this whole big model of all of these different parts of yourself. Let's talk about each area and talk about, are there some areas that maybe need a little bit more attention? Are there some areas that are causing us a little bit more problem, more areas that we have like some disconnect from ourselves, or places we could be paying more attention to?
Right. Yeah, when you were talking about eco wellness, I guess the first thing that came to mind for me was just thinking about something that we might not even see when we work with clients, is just kind of the environment folks are living in. I mean, just, I've done some work, just in the past with people that are living in extreme poverty. And when you see kind of what they're having to deal with day in and day out and what they're living with, that it's affecting them physically, but also, just the whole emotional component.
Yeah.
You want to say more about that? I mean,
I would love to. Whenever I talk about this, that's actually a piece I always really like to bring up is, this is also a social justice issue. And I think that's another reason why it's so important for counselors and mental health professionals to be having these conversations, because climate change, there's all kinds of research out there that shows climate change negatively impacts marginalized populations at a disproportionate level. So people, like you said, like people who live in poverty, climate change will impact them first and hardest. And most of the time too, the people who are impacted the hardest by climate change are the ones they're not the ones who are doing the things that are contributing to it, right? Because the people who are in the most privileged positions, who have the most power, often that's sort of where the problems start. And the people who are being really impacted by this are not most at fault.
Right. Yeah. And so I think, I would imagine that just being able to acknowledge that with a client makes a huge impact for them.
Yeah. And, it's this thing too, that when we start thinking about climate change in terms of like our clinical work, I think it really opens up like whole new avenues for us to go down with our clients that we wouldn't have even considered before, but they're avenues that are incredibly relevant. Like, climate change or access to resources, right? If we're living in poverty or in an urban environment where there's no nature around us, or we're in a food desert or something like that, right? These access to resources, these impacts of climate change, of natural disasters, of being displaced from our homes and not having a place to live anymore. It's like, these are going to impact all of these other areas. They're absolutely going to impact our emotional, mental health, right? But they're also going to impact things like our physical health and our social relationships and just our, stability.
Yeah. It's thinking about some here where I'm located in the Appalachian Mountains. There's a lot. There's a whole culture, generational poverty, and people that this gets into a little bit of the environmental stuff. But where I live here, we're very, very close to the coal fields of Eastern Kentucky, Southwest Virginia, West Virginia, that kind of thing. And if you've ever been into any of those communities, you can see how just the mining and all of that has affected the environment in those locations. And, like some of these coal mining, I call them villages or whatever, that are literally back in the hollers of the mountains, as we call it. And when there's a lot of rain, they are just in this funnel of being flooded. And some work I did a few years ago where we were going in and helping people repair their homes, you really get a good sense of, okay, what would it be like to live in this kind of situation? And it's affecting not only them physically, but mentally as well.
Yeah, absolutely. I actually also used to live in Kentucky, and
Hmm.
one of the places that I think I first like developed my like just real love for nature and being outside was actually in the Red River Gorge in Kentucky.
Yes. Uh-huh.
um, so, but you're so right. It's, you know, it's these people lives, their lives and their livelihood like depend on these things that are actively putting them in harm's way. And it's something that's, you know, not only affecting them, but then it's like it's also having these ripple effects throughout their community, throughout, you know, just larger communities outside of even that. Yeah, it's there's so many layers to it.
Yeah. Yeah, it is. Well, I'm grateful to you, Lauren, for making this something that we can have conversations about and begin to really address in a much more direct way. To change subjects a little bit, tell folks a little bit about kind of your practice and how you mentioned being licensed in both Texas and Colorado. And I know as we were chatting before we started recording, you're actually working for two different practices. And
I
so,
am.
yeah, so what's all that like?
Yeah, it's been great. So I actually moved to Texas about a year ago, so I'm sort of newer to the area. Um, Moved here from Ohio, so I used to live up there in the Midwest area.
Uh-huh.
But yeah, I right now I do some work for two different practices, one in Flower Mound, Texas, one in Denton, Texas, and then I'm also licensed in Colorado, so I can see people virtually there as well. But most of the work I do really focuses on trauma. I see people who have gone through all kinds of trauma. That's sort of what most of my client base is. And then the LGBT community. So, you know,
Mhm.
there's lots of trauma within that too. There's so much hope and joy and beautifulness inside that community, but there's also
Mhm.
a lot of trauma.
Right.
So I really enjoy that work, and I do EMDR too. That's a part of my practice now.
Right, right. So I'm curious too, as you were developing your career, or just thinking about all the different career paths, what what kind of drew you to private practice versus just going to work for an agency somewhere?
Yeah, so my background is actually in agency settings. My practicum and internship in grad school was in like a community mental health agency. And then first job out of grad school was at a foster care agency. And
Mm-hmm.
then after that, I worked in another community mental health agency. So I've been in agencies.
Yes.
And while I loved them and I loved the experience that I got and I loved the people that I got to work with there, it was really draining and it felt like a not incredibly sustainable environment for me to be in. And so when I moved to Texas, I decided that I was going to transition out of that and into private practice. So that's where I'm at now. And it's been really great. And just being
Mm-hmm.
able to have the freedom to, you know, do things in a way that fits for me has been really good because I'm a big advocate for, you know, our clients showing up authentically and showing up as their genuine selves. And I think it's not fair if I can't do the same. And
Right.
I think in agency settings, it was a little bit harder to do that.
Yeah. 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 Very, very good point. And kudos to you for really seeking that. What was it that went into your decision that not to put you on the spot too much of saying, okay, I'm going to go work for a private practice versus I'm going to start my own? What's
Yeah.
gone into that decision for you?
Well, kind of a lot of things. I think just one being where I'm at in life right now, it sort of makes more sense.
Okay. Hmm.
But you know, I think kind of making that transition, especially where I was working before, I lived in the Cincinnati area, and there's all kinds of wonderful like private practices that are thriving in the Cincinnati area, obviously. But my experience specifically was more in the agency settings. And I feel like I didn't really get that, I don't know, guidance of like this, you can do this. This is what it can look like. It doesn't just have to be community mental health all the time,
Hmm.
even though there is a huge need for that. And so part of it was I just wanted to be, you know, around other people who are doing this and you know so I can kind of learn from them and soak up things from them and figure out what this is like because this really was my first experience going into a private practice setting. And so I really like having people around me who know what they're doing and can kind of give me some wisdom.
Oh, yeah, yeah. Well, I think you're exactly right. I think having a community, regardless of what setting you're in, is crucial just our own self-care and just being able to do really good, solid clinical work. Because I think you have to be able to bounce ideas off of people and be able to get feedback and also the support it brings, I think is so important. Yeah.
Yeah. I think,
I was just going to say that people hand us very hard stories and hand us a lot of heavy things. So we need to have a way to process all of that.
Yeah. And I think it's difficult to, do things for the first time when you've never really had exposure to them too. So just being able to gain that from other people. And it's been a really great experience.
Well, good. Well, Lauren, I want to be respectful of your time, and I'm so glad we got to have this conversation. Tell folks how they can get in touch with you if they'd like to have more conversation with you.
Yeah. So best ways to get in touch with me is going to be probably my LinkedIn. You can just look me up, Lauren Hawkins. Should say Flower Mound on there. And then my Psychology Today, you can look me up on there too for any clinical things.
Awesome. And we'll have links in the show notes and the show summary. Well, Lauren, thanks again for being on the podcast, and hope to have another conversation with you here soon. Well, again, a big thanks to Lauren for joining me on the podcast. And I really appreciate her passion for this particular topic of just thinking about how our environment affects us in our mental health, and also just the work that she's doing to really affirm and be there for folks that are maybe feeling kind of marginalized with not only just in their environment, but just in their own lives. And so thanks to Lauren, kudos to Lauren for the work she's doing. And be sure and check her out in her practice. And you can do that by going to the links here in the show notes and the show summary. And I think for most of us, as we've kind of experienced over this summer, just with the extreme heat in a lot of places and just extreme weather with flooding and all of those kinds of things, we really are experiencing some change in our climate and in our environment, and it is affecting us. So I would encourage you to do your little part, whether it's through things like recycling or doing, paying attention to how much water you're using and how much driving you're doing, and just converting over from fossil fuels, all those kinds of things that we know are starting to make a help. I would encourage you to do that. And so again, thanks, Lauren, for joining me on the podcast. And also as I mentioned at the beginning, for those of you that are maybe just getting started in your private practice and want some support along the way, I know for me, one of the things that has always caused my practice to grow is when I got into the right community of other practice owners. And the Practice Launch Club is here for those that are in those beginning stages, just to navigate all the stuff as far as getting your systems and processes in place, being able to kind of figure out how you want to set up your office, how you want to market to potential clients, all of those things. There's a lot to take in. And the Practice Launch Club is there to help folks with that. So be sure to check it out by going to practiceoftherapy.com/launch club. And also, as I mentioned, through the end of September, if you sign up and use the promo code, just PLC Fall 2023, you can get $20 off your monthly membership in that particular program. So, and again, a big thanks to our sponsor of the podcast, Therapy Notes. They're who I use in my practice, and I'm always impressed with all the things that they're doing to improve their platform. It's the leading electronic health record system for mental health providers, and they just do a fantastic job. Their support is second to none, and I can always rely on them in my practice. And it also makes things much easier for our clients with their patient portal. So check them out. Go to practiceoftherapy.com/therapy notes, and be sure and use the promo code just Gordon, GORDON, to get 2 months free. Well, take care, folks. Look forward to you being with me on the next episodes. Got a lot of great people lined up for the podcast. In fact, I had to take a little bit of a break in my interview schedule just because we've got so many in the queue. So come back next week for another episode of the Practice of Therapy podcast. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.